Welcome back, class. It is Dr. Lindner. Let's take a look at what we call the abdominal quadrants and the abdominal regions. So quadrant means four. So we'll look at these four quadrants, and then I'm going to get into regions, which has 9 regions. So when we look at the quadrants, remember we're looking at this person in anatomical position. So this is their right side, this is their left. Even though this is our reading left and our reading right, we always have to refer to it from the patient's perspective. You have to get that down really solid, okay? So there is a right upper quadrant, a right lower quadrant, a left upper quadrant, and a left lower quadrant. And why is this important? This is important because typically when we look at intake forms, whether it's nursing, PA, nurse practitioner, doctors, any type of healthcare facility, you may hear of something where it says, patient walks in with 103-degree fever with pain in their right lower quadrant, stooped over, and their white blood cell count was high. You'd have to be like, okay, well, what do we have organ-wise in that right lower quadrant? And when we look at the quadrants, we can go, oh, maybe it's this little sucker right here called the vermiform appendix. Maybe they have appendicitis. Or patient came in with pain on the posterior scapula, behind the thorax on the posterior side, which means it's on the back side, and pain in the upper right upper quadrant, and pain after eating a fatty meal. So now you're like, all right, you have the location, it's the right upper quadrant. They feel nauseous, they have pain behind the right scapula, and that happens to be the referral pattern for the gallbladder. Gallbladder, like gallstones and gallstone attacks, usually refer pain to the back of the right shoulder blade, but the organ itself is in the right upper quadrant just next to the liver. So after a fatty meal, that's because the liver makes something called bile, and bile emulsifies, which means breaks down fat, but it makes the bile and it stores it in the gallbladder. And when there's fat that's in the stomach, the fat empties into the small intestine, and the small intestine sends a hormone to the gallbladder and makes it contract to push out the bile to break down the fat. So after a fatty meal, if the gallbladder contracts and it pushes it into this ductwork, but you have a stone right there blocking it, that's going to be a little bit uncomfortable. Okay? So that's why understanding the quadrants and knowing your anatomy of what lies within the quadrants is very important. So some doctors and facilities use the regions, the abdominal pelvic regions. So I'm going to teach them to you. And it does show up on some of the quizzes, the Connect quizzes in the past. And again, it's a drag and drop. So umbilical is the easiest because that's where the belly button is, the umbilical region. Gastric means stomach, epi means above. So above the stomach is epigastric. Below, hypo means low or under. Hypogastric is below. The hypogastric is also referred to as the pubic region, and that's where the pubic bone is. So umbilical, epigastric, or hypogastric. The other name for hypogastric is pubic region. Okay, in the adjacent or lateral to both the umbilical region, remember this is the left side and this is the patient's right side, there is a right lumbar region and a left lumbar region. These are also called flanks. So there's a left flank and a right flank. The flanks sometimes we call the love handles, right? The love handles. either lumbar region or flanks. Below that is the inguinal region. We have an inguinal ligament going in this direction. Some people have had an inguinal hernia in that region. So there's a left inguinal and a right inguinal region. The only two that are left are the hypochondriac. Now, chondria means cartilage. Cartilage of what? The ribs. So hypochondriac, these are below the ribs. So there's a left hypochondriac region and a right hypochondriac region below the rib cartilage. Okay, so now when we get to the McGraw-Hill Connect quizzes, again, these blue items would be off to the side. You'd have to do a drag and drop. So you'd start with the belly button being umbilical. Above it, remember, epi means above. So that's the epigastric. Below it is the hypogastric, but this is also the pubic bone, so it's the pubic region. Adjacent to it are the inguinal ligaments, the inguinal hernia, the inguinal region. So there's a left inguinal and a right inguinal. Where the love handles are, that's the lumbar region or the flanks. So there's a right flank and a left flank. And under the ribs are the left hypochondriac and right hypochondriac. Chondro is cartilage. Hypo means under, so under the rib cartilage. And again, these are the 9 regions. The anatomy doesn't change. The liver is still there. The gallbladder is still there. Now, the organs are in different regions. When we overlap them, right, you can see here's the 4 quadrants, the organs. The liver is the liver. Stomach is the stomach. Gallbladder is the gallbladder. That doesn't change. It's just we go from quadrants to regions. Okay? All right. When we come back, we'll get into planes.